the patient has, and it can also reduce time to intervention, such as thrombolysis or thrombectomy, which is just um, some surgical procedures. And it can be also used for lesion detection and segmentation, which it can identify like tumors, ischemic strokes, hemorrhages, or white matter lesions. So it is very, very important in like diagnosing what the patient has, what type of neurological disorder it has. And it can also kind of do like a quantitative assessment, which essentially means like the size of the lesion or like the lesion volume or disease progression. And that can help medics prioritize what patients to look at because, as you may know, the NHS wait list is very, very like it's just expanding. So we do need some sort of prioritization system to help combat that essentially. It can also be used for neurodegenerative or psychiatric disorders. So early detection of like Alzheimer's, Parkinson's, or multiple sclerosis can also be helped because it can help prevent like it can improve the prognosis of patients if their disease or that disorder is like um diagnosed earlier because they can get more medical intervention. AI can also be used for analysis of like cortical thickness, so that's the thickness in the brain, and hippocampal volume and connectivity patterns. So that just means like neuron connectivity patterns. Um, and so some benefits and limitations and future perspectives of of AI in neuroimaging. Obviously, there are many because it is a very newly emerging like technology. So some benefits are that it can help with faster image interpretation and it can help reduce workload for the medics because obviously trying to actually look at what is wrong with the patient from a CT scan or MRI scan it's very time consuming. So using AI in assistance or by itself can help reduce workload. And it can also help with increased reproducibility and standardization, which essentially are really big words for saying that it can help with kind of just generalizing everything and making sure that if like the standard is set high for the AI diagnosis systems, the AI will work to that standard and will make sure that all the different CT scans it gets, it can do the same process with them all. But obviously with humans, there is some limitations to us, to the fact that like let's say we don't get good sleep or we're in a bad mood, then we might not be able to pick up things that AI can with AI's standardization. And so limitations and challenges include like dependence on large, high quality annotated data sets to actually help the algorithm learn how to like diagnose patients. So, yeah, they need to be fed a lot of data essentially before they actually get to a standard where they can be used for diagnosis. There is a potential algorithmic bias, as you may have noticed if you use ChatGPT, it does have some sort of algorithmic bias where it only talks in a certain way. So you can tell when someone has used ChatGPT most of the time. And it can also, this can also lead to a lack of generalizability, which essentially means like it might make everything very like um, very general and it's not very like personal to the actual patient and looking at the actual patient's like patient history or just in general. And limited transparency of like deep learning models, as you may have heard of like some articles. Um, there are many like scary things happening with AI, and we don't really know how AI is working anymore. So that is what it kind of links to. Like we don't know what AI could do with the patient confidential information we give to AI. So it could be an ethical challenge. So future directions, something that artificial intelligent workers are looking to, incorporate in medicine, medical AI is development of explainable AI systems. So that kind of links to the last point I talked about, which is limited like transparency. Um, so yeah, so that's what they're currently working on, and integration with like clinical, genetic, and biomarker data. So just so then AI can be fed those things, so then it can look at the neuroimaging scans in a more of like a context instead of just generalizing, like just saying, oh yeah, that's that. But like with patients, like obviously there's a whole story to the patient, like the whole patient history, the comorbidities they could have, like the side disorders or some other healthcare conditions they could have. So being fed all that information can help move AI toward a more personalized and predictive neurology. Now we'll move on to see how AI is used for surgical planning. So obviously now clinicians must rely on their own expertise and what they learned in medical school and their residency to interpret and understand anatomies from like 2D cross-sectional images, so like the MRI scans, to see, oh yeah, that's where the tumor is. We need to get it out from there. And so this could sometimes lead to incomplete understanding, and this can lead to like preventable complications. So obviously human error, essentially. And so while these 3D models would improve understandings, surgeons often lack the time because obviously neurosurgery is a very, very intensive job. And so you don't always have the time to kind of plan with like 3D models. And sometimes you're not given the training to use those 3D models because they are very emerging, like newly emerging technologies need like to use them. So it's quite limited to how many hospitals or how many neurosurgeons are actually trained to do that. Then AI technology in hospital settings assists like surgeons to reduce surgical errors and to improve patient outcomes, and thus reducing like unnecessary financial strain on the NHS. And also, I'd like to add to the point where it can help with efficiency essentially, and it can help make the surgery better in a sense. And this can also help with the wait list that we currently have. Ways AI is used in surgical planning. So AI algorithms can analyze a patient's data to predict individual risk profiles and identify optimal surgical candidates for integrating like medical histories and laboratory values and imaging studies. So again, this is a very complicated way of saying that AI algorithms can analyze a patient's data to predict like individual risk of like complications in this procedure. So it can help plan out like routes to take if some sort of complication happens, because let's say a patient has some cardiac disease, like they I don't know, they have some sort of like chronic heart condition. And so then AI can analyze that patient's data and be like, oh well, they might need some heart support. Um, if they're doing a neurosurgery, maybe they might not be able to handle the consequences that come with a neurosurgery, because obviously it's a very intense surgery. So your body, like the patient's body needs to be able to handle that. So sometimes it does help with like planning what to do. Basically like plan A, plan B of what to do when something happens. It can also analyze medical records and images, offering like a very personalized treatment plan and risk assessments to optimize that planning. Um, and so it might give like out of the box type of solutions to some problems that surgeons may not be able to think on the spot. So it is good to use AI in like pre-surgical planning, essentially. AI and robotics, which we'll go on to later, also enable like minimally invasive procedures using like robotic systems because it can help provide like precise tissue assessment feedback. Because obviously with a human, even if they're like very skilled, you will have some sort of hand tremor. But with a robot, it could be very more precise. And also humans are limited by a lot of factors like sleep again. And technologies such as image-guided surgery systems can improve surgical orientation and patient outcomes by helping surgeons identify anatomical structures quickly and reliably. So they can help identify, oh, this is where the tumor is, or this is where the, I don't know, brain bleeding happened. So it can help the surgeon kind of navigate quickly and make sure it doesn't cause that much of a damage. Um, Other ways is that AI algorithms for image interpretation and processors dedicated to AI functions significantly reduce technical and financial requirements for obtaining like detailed 3D images of a patient's anatomy because like MRI scans are really expensive. Obviously, we are in a free healthcare system, but worldwide it is very expensive. So AI algorithms for like you know just interpreting like neuroimaging scans can help reduce the technical and financial requirements. And so for those people that are interested in plastic surgery, computer vision and deep learning algorithms analyze preoperative images to help like generate realistic visualizations of the surgical outcome. So kind of like a simulation where they like predict how the patient will kind of look like. And so it will help align the patient's expectations with achievable results and facilitating communication between like patient and doctor and surgeon so they can go back between and forth so then they can talk about the achievable outcomes. And compared with like traditional methods, the AI assisted like methods have shorter model reconstructions times, so it's quite fast. And it has higher accuracy of anatomical structures. So it's more accurate and it reduces operative times and it can also reduce like, the blood loss that happens during surgery. It can help reduce that. It can also it can help with shortening the time where there's a post-operative chest tube duration and reduce like post-operative hospital stays and just in total making the experience a little more shorter and more bearable for the patient. Okay, AI in post-op care. So AI has emerged as a very transformative tool, not in just post-operative care, but also as we previously talked about, neuroimaging scans and pre-op and during surgery, we tend to use robotics more. But so the core roles in AI for post-operative care is to kind of continuously monitor and analyze patients because obviously if you just got a surgery done, there are many complications that can arise. And we have covered a couple in the previous seminars. So if you haven't attended them or you didn't get the chance to, you can check out our YouTube channel for the seminar recordings. But yeah, it can help with just monitoring the patient and so making sure that the surgeons are alarmed just as soon as that complication arises, so then it doesn't cause as much damage as it would have caused if it wasn't analyzed quicker. And processing vast amounts of patient data, obviously, because there are a lot of patients, and it can help um, process that data faster, which will reduce workload and also reduce the waiting list. And it can also help with early detection of degenerative disease. So as you talked about Alzheimer's disease, Parkinson's disease, and so those type of diseases, it can help with early detection depending on the symptoms that the patient is showcasing. And so AI is used for, again, earlier detection of worsening health. So obviously if it's detected that the patient may be like downgrading and like deteriorating, then the patient can get medical intervention quicker, and which can help reduce like make the prognosis outcomes better. and so it can reduce probabilities of error due to its accuracy. Again, human error, and obviously using AI like technology alongside alongside human expertise will help reduce probability of errors. And it can help again work alongside medics so then it can assist them and make the process a bit more efficient. Key applications is complication detection. So obviously operatively, AI kind of detects complications like hemorrhages or like infections earlier than conventional methods through continuous vital sign analysis. So they will keep checking, AI will keep checking to make sure that there's no like brain bleeds or herniation or infection happening in the brain. And that can help obviously with uh, getting medical intervention quicker for the patient, and that can improve patient outcomes. Rehabilitation, so the integration of AI-powered tools like virtual reality and wearable devices is revolutionizing post-operative rehabilitation in neurosurgery because as we talked about, the patient outcomes in neurosurgery are quite low. Like they're very, sometimes they're not the best. And so using AI or AI technology can help with that rehabilitation because patients do require like physiotherapy, cognitive and behavioral therapy, and speech therapy, depending on where in the brain the surgeon operated. And so using AI with that can help with personalized exercise regimens and real-time progress tracking, which can enhance patient outcomes again. So some benefits, ethics, and like limitations of AI being used in healthcare is that it can help reduce post-operative complications and the effects of those complications if they do arise. They're more time efficient because not every like surgeon can go around like continuously monitoring every patient they've ever worked on. So using AI can help with that because humans also need rest, but AI doesn't. And so it reduces admission of patients because it kind of just like continuously checks up on them. So then they make sure that there are no chances of like more complications arising. And again, it can reduce human error. Limitations are obviously ethical concerns surrounding the use of AI, for example, the effect of on the environment, just using ChatGPT. It releases a lot of water, uses a lot of water, so obviously it is affecting the environment. And obviously on a bigger scale, like a medical AI technology would be even worse. And it cannot like replace clinical judgment most of the time. Like AI is good and all, but like what the doctor says, what the doctor has experience in is what really matters because the doctor has that human element in them where they can talk about, oh, you know, like this is the case for this patient specifically. You would need a lot of training to get AI to that point. And data bias in algorithms, again, like AI tends to get a sort of like trend where they might be like, oh yeah, this patient had a tumor, so this patient may also have a tumor, which can lead to misdiagnosis, and that can have an impact. So again, ethical concerns is that if AI makes a mistake and it diagnoses something incorrectly or doesn't diagnose at all, then it can cause medics to kind of take accountability for that. And that can arise with a lot of lawsuits or even mental health conditions. Um, and patient data and privacy and like the confidentiality because we are kind of feeding AI all that confidential information that patients may not consent to. So obviously it's very important to get that consent first of all and make sure it's informed because if it's not informed and you just like, oh yeah, we're using AI, but you don't tell them of like the possible risks, then it won't really be informed and it wouldn't align with the ethics that has been set by the NHS. Okay, can we have Anastasia for this, please?
Okay, so now we're going to be talking about robotics in the theatre. Okay, so what are the surgical robots? So surgical robots are computer-controlled systems that surgeons use during operations. And essentially, the surgeon controls the system from a console and translating hand movements into highly precise actions. And in neurosurgery, these tools are used to help protect delicate brain structures. So essentially, they are used to make sure that surgeries are not invasive as possible and helps protect very vital parts of the brain. And um, why they're used is because they improve accuracy, they also reduce tissue damage, and they provide stable instrument control during complex procedures. And robotic systems also provide careful preoperative planning and detailed visualization. So overall, they just kind of increase the accuracy of procedures as well as protect the brain health during surgeries. So please. Okay, so types of robotic systems. So some robotic guided instruments use MRI scans or CT-based scans to for tasks such as biopsies and electrode placements, and other ones use multi-arm platforms, like I believe the image over here shows that type of um that type of robot, and they kind of use cameras for minimally invasive surgery. And then there's also newer systems that are starting to incorporate AI for safety and positioning. And specifically for neurosurgery, we have robots that assist with tumor removals, deep brain stimulation electrode insertions, and brain biopsies. And also, we also have imaging guidance, which helps surgeons avoid blood vessels in critical functional areas. Next slide, please. Okay, so we have some benefits and also some limitations, and some benefits of using robotics is that robotic assistance can increase precision. It can also reduce hand tremor, which is essentially that could cause that's a really common issue when it comes to surgeons because especially as their age increases, they are kind of more susceptible to having hand tremors. And so having these things such as robotic surgery can allow them to kind of move that thing away, and it helps increase that precision essentially. And also we have it also allows smaller incisions that often lead to quicker recovery. We also have ergonomic consoles, and these reduce physical strain on the surgeons during long operations. So we're kind of moving from the patient aspect to the surgeon. So it also helps the surgeons as well and the MDT in the operative room because it allows them to have more energy to kind of carry out the surgery, which in turn increases the chances of a better surgery overall. But however, we also have limitations, and some of the limitations are that these systems are very costly and require specialist training. So, as we already know with the NHS is not really in a good position right now financially. And so, adding these robotic systems can definitely have a big financial strain on the NHS, and as well as the specialist positions and training is systems going on that can also add on to the strain of that. And so, because of that, there is very limited access in hospitals. And then we also have dependence on technology and ethical responsibilities. So, if errors were to occur, it also could pose a really important concerns. So, these technologies aren't as ethical as they could be at the moment. And so, these are very important issues that need to be taken into account when using these robots. Next slide, please. Okay, so where is it heading next? So we have AI integration. So AI will assist surgical planning and provide real-time guidance during operations. It will also help surgeons choose safer paths and protect critical brain structures. So essentially it's going to be used as kind of like a second opinion to make surgeries more safer and more better for patients. We also have remote and miniature robots. So we have advances. So advances may allow robot expert support and introduce smaller flexible robot tools that can operate through tiny openings, so overall will increasing the precision and the accuracy of these procedures. And then we also have training and careers. So surgeons will also develop skills in robotics, data interpretation, human machine teamwork, and creating new specialist roles within neurosurgery. Next slide, please. Okay, so now we're going to move on to intraoperative um, care guidance systems. So in terms of the introduction to intraoperative guidance systems, it's essentially a technology that uses um, medical imaging such as CT scans, MRI scans, or fluoroscopy, and real-time tracking to provide 3D visualization of a patient's anatomy during a procedure. So it's kind of like a GPS, and it allows surgeons to see the exact position of their instruments on a digital map per se, and allows and of the patient, and even when the surgical target is not visible. So as you can see on the image below, you can see there's two screens and the surgeons are all looking at the screen. So that's kind of an example of what's the intraoperative guidance systems are. And essentially what's doing is allows for precision and identification of tumors. And it also ensures that there's a safe entry and reach of different parts of the brain during surgery by providing live feedback tools and live feedback on tools trajectory and enhances accuracy for implants. So in terms of infrastructure, we have specialized markers and tools. So essentially what that is the physical objects that can bridge the gap between digital scan and a real patient. So for example, a type of marker is a dynamite reference frames, and there are markers that are fixed directly onto the patient's anatomy. So they can be clamped to the skull or screwed into the vertebrae so that the surgeon is able to locate them later on. We also have core systems architecture, and that's essentially the functional backbone that allows the system to process data and also provide real time guidance. And it consists of a high performance computer that that has specialized software and a coordinate transformation manager that maintains the spatial relationship between the patient, the room, and the tools at all times. And then we also have tracking modalities, and these are the eyes of an intraoperative guidance system. And there are two types. We have optical tracking uses high resolution infrared cameras that to see markers attached to the instruments of the patients. And then we have EM systems that use a field generator that creates a low intensity magnetic field around the surgical site. So, benefits of intraoperative guidance. So, clinical benefits include enhanced precision during surgery, especially danger zones where there's nerves and blood vessels. And we also have reduced invasiveness and lower radiation exposure, which increases the surgeon's confidence. We also have technical barriers. So, despite the benefits, there's also some challenges to this system. So, the first issue is tissue shift. So, in real time surgery changes, for example, the brain sagging after the skull is open or a soft tissue moving, that can make the preoperative CT scan or MRI scan map inaccurate. We also have optical systems. So if a surgeon's head or a piece of equipment blocks the camera view of the markers, and then we also have the setup tax, which is the registration and equipment calibration, and it can add 15 to 30 minutes to the total surgery time. So that increases the exposure to the brain, and that can harm the patients per se. So it's not really ideal to increase that much time to the surgery. Now we're going to move on to ethics and responsibility. So we're going to be talking about a few of the medical pillars of it. the ethical pillars of medical ethics, and one of them is autonomy. So, first of all, we are going to touch upon informed consent. So, patients need to be made fully aware of their data and the fact that it's been analyzed by AI, because we cannot be sharing their information like that to AI. So this might be some people that may not really agree with that as well. So remaining transparent about AI use with the patients helps maintain the clinical patient relationship. We also have shared decision making. So when using AI, doctors should run through any AI suggestions before using it to diagnose treatment of patients, because as we all know, AI does make a lot of errors. So it's very important that doctors or any healthcare professionals are going through that information before telling the patients. Next slide, please. Okay, so in terms of non-maleficence, we also have bias and misinformation. So an AI system could be trained predominantly on data from a specific population, for example, middle-aged male patients, and so that may not be it may not perform well when diagnosing other patients from other demographics, so it could be a bit biased, and that could lead to mixed diagnosis or inappropriate treatment of those patients. So it's very important that we're making sure that the AI system that we're using is as inclusive as possible to kind of reduce these errors. Then we also have over reliance on AI. So healthcare professionals may become too reliant on AI, which can compromise clinical judgment. So as we all know, it's very important that we have to make sure that we are double checking the information that we are giving to patients. And so it's important for clinicians to thoroughly evaluate AI treatment plans before treating patients, or to prevent unintentionally harm patients. Next slide, please. Justice. So we also have healthcare disparities. So we can have an AI that can further so AI can further existing inequalities, as some underfunded hospitals in low income or rural areas may not have access to newly developed AI tools, which could widen the gap in the patient treatment between different populations. So as we already know, with the NHS and the healthcare systems, not every hospital is at their best at the moment. So adding these AI tools can increase that inequality and may also decrease the trust that the patients within that certain city may have on their NHS system, because they may not feel like they are being treated as well as other places. So that's not really ideal. And we also have algorithmic bias. So AI may be trained on systems with biased data, leading to systematic inequality where certain patients may be underdiagnosed or overdiagnosed, which furthering ethical AI using neurosurgery will require databases to be thoroughly trained and monitored using unbiased data. So it's very important that we are making sure that the data we are using is unbiased, to make sure that the care that we are giving to patients is fair and equal for everyone. Okay, so now we're going to move on to limitations and failures. So some core limitations are, so AI systems depend on large medical data sets. So if these data sets are not complete, AI predictions, if these data sets are not complete, it could result in a lot of issues. We also have models that can perform poorly, and dealing with rare neurological conditions or patient groups that are underrepresented in training data. So, for example, if we're using AI to retrieve information, that may not be as common. The AI tool may struggle to find information, and so it could result in some errors when it comes to diagnosis. We also have clinical decision making is negatively impacted, as AI isn't able to fully understand a patient's context, for example, medical history of lifestyle choices. So, as we mentioned previously, AI does not have those human elements that a healthcare professional has. So, they may have not been there for the previous checkups, or they may have not been there to um, listen to the patient's concerns and other things behind the patient's condition. So that's definitely a limitation. And then we also have AI being logical, lacks human empathy, as I mentioned previously, judgment and experience. And these are all qualities that a clinician should have. So, in terms of failures and technical risks, we have that AI can fail by misidentifying or missing abnormalities in the brain scans, which may lead to incorrect diagnosis or surgical errors. We also have errors that may occur due to biased training data, outdated algorithms, or software bugs with clinical systems. And in neurosurgery, even small errors can have serious life changing consequences for patients. So it's vital that these AI tools are closely monitored within surgery by any healthcare professional or surgeon. Next slide, please. Okay, so in terms of some practical limitations and risks, so there is a risk that clinicians may become over-reliant on AI and potentially leading to human review of decisions, which is critical. And these limitations impact the failure of AI as errors could be unnoticed with a lack of human overlooking. So it's very important that when we are using these AI tools and where these healthcare professionals are using them, that they are constantly checking over them and not turning a blind eye over it and just believing that that is the right course to go ahead because there may be errors. And not all hospitals, as I mentioned previously, are able to access these AI systems as they tend to be expensive and develop and they may be expensive to develop as well as maintain meaningless patients that can receive the benefits of AI. So not all hospitals can also get this equipment. So it's very important that we are also being as fair and equal with everyone. Next slide, please. Okay, now I'm gonna hand it over to Serena, who's going to be doing the quiz.
Thank you very much, Anastasia. So this quiz will basically be, again, just summing up everything we talked about in this seminar. And yeah, it will have like some scenario-based questions. And one of the last two questions have like answer prompts for it. So they might be like, I mean, if you get like a very evil interviewer for your university applications, you might get some sort of these type of questions. So it is very helpful to especially learning about the ethics and responsibility of using AI in medicine. It is also a hot topic currently, so you are likely to get like asked about it. And so yeah, just answer in the chat and I'll give you some time to think about the question and ponder upon it. Okay, so question one is a patient has glioblastoma, which is basically a tumor, brain tumor, near the motor cortex, so part of the brain. And AI-assisted planning suggests a resection plan that minimizes tumor removal, but has a 15% predicted risk of permanent motor deficit. So what is the best approach? A, follow the AI plan exactly. So maximal tumor removal is always the best. So just removing all of the tumor is the best. B, modifying the AI plan to reduce risk, even if it means to leave some of the tumor, which could potentially grow and kind of cause that same effect again. C, ignore AI and plan manually. So like without AI and just planning with the surgical MGT team. Or D, cancel surgery. Okay, I'll give you like 30 seconds, around a minute. And while you're thinking, I'm just going to like break down some of the really hard words here. So resection plan basically means just taking out the removal, like the tumor. So that is basically what resection means, just removing the tumor. And permanent motor deficit means like maybe it could have a impact on how the patient moves in a way that it could lead to partial paralysis or full paralysis. So it's just talking about 15% predicted risk of that. So yeah, 30 seconds. All right, we're getting a couple B's, and yes, that is the correct answer. So, most of the time when surgeons operate on a very uh important area, and it's like the tumor is going to that area, like it's very close, then sometimes surgeons actually remove half or more than half of the tumor and leave a little bit in, just to make sure that they don't damage a very, very important part of the brain, because that damage is again permanent. So the tumor may grow back again, but we can always just do some surgical sort of an intervention and kind of prevent that from occurring again. But removing the tumor and causing permanent damage is worse in a sense. Okay, question two. AI analyzes preoperative imaging and predicts postoperative cognitive decline. How should this be integrated into the surgical planning? So, A, use AI prediction as absolute truth. B, combine AI output with with clinical judgment and patient values. Or C, avoid using AI for ethical reasons, such as when we previously, Anastasia touched upon the ethics and responsibilities of using AI. Or D, letting the AI decide the surgical approach entirely. 30 seconds. Okay, we got a couple B's, and that is correct because AI output is most of the time correct, but if there are mistakes in that AI output, it can be very big, and it can cause a lot of complications later down the line while you're doing the surgery or even post-operative. And obviously the doctor is there to have some sort of clinical judgment. So if they just rely on AI, then patients can just go on to ChatGPT and search, oh yeah, I'm getting this symptom. What do I have? And AI would be like, oh yeah, you have a brain tumor. Like, you do need some sort of clinical judgment and patient like values in their backstory and their patient history, just to kind of use that AI output as something to consider, but not to fully rely on. All right, this is a scenario. Post-operative imaging shows unexpected tissue changes not predicted by AI. So AI didn't predict what happened, and the team must decide whether to intervene immediately or monitor. So the question is, how can AI assist in decision making here, and what are its limitations? So here are some answer prompts, but I would like you to, I'll read these out and I'd like you to give me your opinion or maybe a sort of like idea that you may also have, or maybe you agree with this or disagree with this and a statement why, essentially. So AI can compare with large data sets to suggest probability of like complications. It cannot replace real-time clinical judgments. And the team must integrate AI insights with patients' specific factors. So obviously, all three of these statements are kind of uh, differentiating from each other. So the first one is A, second one's B, and third one's C. So which one are you the most aligned to? And maybe a reason why. Here, you could consider the ethics and responsibility section that Anastasia went over, and like the four pillars of medical ethics, so non-maleficence, beneficence, and justice, and patient autonomy. So, considering those and what just happened in this scenario, what would you think is the best possible answer? I do see people typing, so I'll just give it a little more time. Okay, we're getting some answers now. So a lot of people are saying B, and one person actually wrote an answer down. B, because clinical judgment would outweigh AI in this case, as AI isn't aware of like the patient's medical history unless it's been told. And Ellie is saying, I kind of agree with all of them because AI is a helpful tool as a tool to analyze lots of data. But if it already failed to predict the tissue changes that they probably shouldn't rely on it as much. So yeah, I agree with that because AI obviously does make mistakes, and it did make a mistake here where it didn't predict a complication. So you do realize that you can't use AI fully. And Leah said, although responses from AI are sometimes faster than humans, I agree with B, the most as clinicians are able to um, give a more holistic approach for the patient, which is true. And so professionals could view the patient's behavior and symptoms physically with which is something AI couldn't do. And team must integrate AI insights. So Jessica agrees with C. With specific factors, this is because combining the artificial intellect of AI with the known facts concerning the patient's case would allow the surgeons to make a more personalized decisions and like for the patients. And Adelina is saying due to his previous AI inaccuracy, so relating to Leah's point here, sorry, Ellie's point here. Um, However, they cannot rely on AI output and must provide some support of like some sort of clinical judgment alongside AI assistance. In terms of looking at the patient medical history, um, the team of medics can assess the medical history as well sorry, as will providing AI with patient information only with informed consent from the patient, in which AI can analyze data more quickly. So all of these are like correct because this is an open-ended question, and all of these insights are very, very helpful. And they're all correct. Obviously, you can have an opinion on AI, and that's what the interviewers want. They kind of just want to see you incorporating the GMC guidelines and the medical ethics that you have learned about from these seminars and just in your own wider reading. So yeah, this is really good. We do have another one, so maybe we can do this as well, and then we'll hand over to Silver to do the cancer awareness presentation. Your hospital wants to implement AI-assisted neurosurgery for tumor mapping. Which ethical considerations are critical? So you need to identify three key ethical points. So I guess I've not cut this off, but patient consent and understanding of AI role is very important. So this is the answer, guys. I'm so sorry. And data privacy and like secure handling of imaging and records and bias in AI algorithms, because obviously, as Anastasia talked about, there's a very underrepresented um, populations in training data. So if you want, you can give me some thoughts on what you think about this, and if you were in this situation, what you would do. Because obviously these are the answers, but I would appreciate some of your insights. You can write them down in the chat, and then while we do that, we can move on to the World Cancer Day because we are kind of running over. But yes, Silver, can you take over, please?
Okay, so this is a presentation on World Cancer Day, which is the 4th of February, and this presentation is just to spread awareness about cancers. Okay, so what is cancer? Cancer is a disease where abnormal cells grow uncontrollably. These cells can form tumours and spread to other parts of the body. This is known as metastasizing, and it can have huge implications for both the people with cancer and without cancer. So it can have really big implications on family members of people who have cancers in terms of their mental health, and also the people who are struggling with the cancer. So how does cancer start? Cancer starts when there's damage, DNA damage in cells. There's errors during cell division. There's exposure to harmful substances. Sometimes some cancers can be inherited through genes. For example, the BRCA gene in breast cancer. Cancer is not just one disease; it's a combination as it impacts many different areas. You can have breast cancer, which can impact both the breast cells and other uterine tissues as well. So some common types of cancer is breast cancer, lung cancer, skin cancer, prostate cancer, and colorectal cancer. Breast cancer is the most common one in women, and then prostate cancer is really common in men. And then there's also pancreatic cancer, which is one of the most common between both. They actually found one doctor thinks that he's found a cure for pancreatic cancer as well. But anyway, breast cancer is cancer that develops in the breast tissue and is one of the most common cancers in women worldwide. Lung cancer is cancer that starts in the lungs, and it's often linked to smoking or long-term exposure to harmful substances, for example, vaping or toxins in the air. Skin cancer, this is cancer caused by damaged skin cells, commonly due to the excessive sun or UV exposure. Prostate cancer is cancer that affects the prostate gland in males and usually grows quite slowly. And colorectal cancer is cancer that begins in the colon or rectum and can be influenced by diet, lifestyle, and genetics. So some causes and risk factors. Some causes and risk factors can be smoking and vaping, poor diet and also lack of exercise, alcohol usage or over excess of alcohol usage, sun exposure, and genetics. Smoking and vaping can introduce harmful chemicals into the body that damage cells and increase the risk of cancers such as lung cancer and throat cancer. Food and diet and lack of exercise can weaken the immune system, and this can increase the chances of cancer such as colorectal cancer. Alcohol usage can actually damage cells and increase the risk of cancers, including liver, breast, and mouth cancer. Sun exposure and UV radiation damages skin cells and is the main cause of most skin cancers, for example, melanoma. Genetics can also impact some people in terms of their inherited genes, and that can increase their risk of developing certain cancers, e.g., breast cancer. Some signs and symptoms. Some signs can be unusual lumps or swelling, unexplained weight loss, long-lasting pain, fatigue, changes in skin or moles. However, none of these are definite indicators of cancer, but they should be checked by a doctor because they could be signs that you may be developing a cancer. So prevention and reducing risk. Some ways you can prevent is by not smoking or vaping, eating a balanced diet, exercising regularly, using sunscreen, and actually getting regular health checks. Prevention equals empowerment, and these small habits can reduce risk as they can allow you to stay safe and make sure you are checking out for any issues that could come later. And these can also be risk factors for many other diseases and conditions, not just cancer. So some cancer treatment options include surgery, chemotherapy, radiation therapy, immunotherapy, targeted therapy. However, there are new treatments that are always developing. For example, there's a treatment where they actually have targeted cells that come in and actually kill cancer cells. They figured out that some cells have specific receptors on them, so those cells are then killed by those new cells that they introduce into the body. So, how do you support someone who has cancer? You need to be kind and patient, listen without judgment, and offer practical help, and also avoid myths and stereotypes. And also remember that these are people, so still treat them as if how you would normally treat people without cancer. Just be a bit more sensitive to their circumstances. So, why cancer awareness matters? It allows for early detection and can also save lives. It can reduce stigma against people who do have cancer, and it can encourage healthy choices, for example, maybe stopping smoking or any unhealthy behaviours that you do have, and can also allow us to support people who are currently being affected by these cancers. But anyway, thank you for listening.
Thank you very much, Silver. This was very helpful. And I'm sure that obviously, because Cancer Awareness Day is coming up soon, we will be more mindful about people that have cancer. And as we grow up and learn about medicine, and when we become medics or surgeons, we treat these patients with care and awareness and empathy, which obviously by that time you will understand why they need empathy. But yeah, I'm gonna put up the attendance form and I'm gonna stop sharing the screen. Um, it would be helpful if you could fill it up because we do issue like certificates if you attend 5 seminars. So we'll yeah, I'm just gonna put it up. I apologize. That's the form, guys. Can please, it'll be very helpful to fill it up. And yeah, that is all for this week's seminar. And we're gonna continue the neurosurgical like seminars that we're doing right now. But we do have a guest speaker coming in next week. So that's quite exciting. I hope you guys enjoyed. All right, bye. See you next week.